been rather successful here at the county in our partnerships with FEMA and the state. You've heard us talk a lot about debris removal publicly. The county and the cities cleared over 15 million cubic yards of debris. That was the largest peacetime civilian-led debris removal project in the history of the United States. There have been larger projects, but those in the past have been run either by the Corps of the Army Corps of Engineers or by individual states. And so we're proud to have done that. We were able to receive over 75% of our expenditures back within the first 12 months after the hurricane. So that has allowed us to pay back a significant amount of the $250 million that we had to borrow to create float and have cash flow to pay those bills, and also helped us to avoid several $1 million in interest. We're seeking funding from several outside sources to help bolster the county's budget, and all of that collectively is why we were able to put a budget in front of the county commission last year that did not require a tax increase. Growth so far this year is projected to be up about 7%. We're still evaluating how much of that will go into the CRA versus how much will come to the county. But prior to the onset of this event with the virus and that response, things were looking very well from a financial recovery perspective. I want to transition a little bit now into what we're doing regarding the virus response. I think that's probably the forefront of everybody's mind. Unlike you've seen in the past with wildfires or hazardous materials incidents or hurricanes, the county is not the lead agency. We are not in the incident command chair, so to speak, with this event. This is a Department of Health and a Centers for Disease Control led incident, and there's been some conversation and some pull to begin transitioning the operational aspect of this at the federal level under FEMA. But here locally, it's our role to provide support to the Department of Health, locally our local health department, and then at the state level, the Florida Department of Health is an entity, as well as the governor and his staff. So we are primarily the logistics lead right now. We're participating in also helping with staffing what's called a Joint Information Center. All of the public information officers from the major organizations throughout the county, the public organizations, whether it's the sheriff, the individual cities, the county, have all staffed a Joint Information Center to assist Heather Kretzer, who is the PIO for the local county health unit, to help her with getting information out, making media calls, producing materials to get out to the public so we can get information out there. Behind the scenes, our personnel are heavily involved in logistics. So you've seen a lot of conversation at the federal level about supplies moving around and the need for different types of personal protective equipment and ventilators. We're working very closely with our partners here in the community to make sure we have a full understanding of what resources they have, what resources they would be deficient in, at what point in time they project they would become deficient, and then working through Tallahassee and through FEMA to make sure that those orders are being placed, and trying to get those resources pre-identified and staged so that we have them here in the community prior to them being needed. With that being said, on the first stage of this, the feedback we're getting from both of our medical facilities is that they're adequately equipped currently. They have adequate number of beds available, both standard beds and ICU beds. Now, keep in mind that's the thought process there being is, you know, a typical type situation like flu, for example. One of the things that concerns all of us is this subject of a surge, where we would have this sudden onset of, you know, hundreds, if you will, of patients in the county that would all of a sudden present at these facilities, and then they would be overrun. And so we're trying to think 2 or 3 generations ahead, not so much for where we need to be today. We feel like we've got equipment, personal protective equipment covered for where we are right now over the short term. But the longer term issue, we're trying to make sure that we understand those deficiencies, and we're getting those orders placed and trying to coordinate with our partners. And of course, you can imagine, you know, there's a very long line. We're standing in line between all those communities across the nation who are, you know, already hot spots. So New York, Miami-Dade, you know, New Orleans. And so, you know, we are receiving materials. But for example, let's say if we make a request for 1,500 masks or gowns or sets of eye protection, we're probably seeing 10% of that that's actually being delivered incrementally. And what we're not having to assign to first responders and healthcare providers who may have some short-term deficiencies, we're stockpiling that so we can be ready to deploy it in the event going forward. There's also been an initiative to work with local property owners, hotel owners specifically. A number of them have come forward and volunteered the use of their facilities in the event that capacity is needed for additional beds. You've seen some of that going on in the state of New York, for example, with the Javits Center. The initial concept that was explored there was potentially utilizing these facilities to house patients who had presented with and had been tested with and presented with the virus. That school of thought has changed a little bit in the last 48 hours, and the thought process now is that any beds of that nature that are opened up would probably be used for traditional healthcare provision, non-ICU uses, types of treatments that could be provided that maybe the patient requires a hospital bed, but they're not positive with the virus. They're not going to need intensive care, or perhaps not have to be in a situation where they're on a ventilator. So we're currently working with the state of Florida to make sure they're aware of where those properties are and who's interested in linking those owners up with the state. And we're having follow-on conversations about what type of equipment and staffing and materials and whatnot would be needed, and trying to do our role to help our state and federal partners be able to put that together, so that in the event that needs to be turned on here in our community, we can make that happen and take care of all of our neighbors. There's been a lot of conversations about testing. One of the preeminent messages that we try to make sure goes out every day, and the local health department tries to make go out every day, is the criteria for testing. There's a lot of confusion out there. We hear a lot of information from people that say they are being refused tests. The information that we're getting back is that individuals who are being refused tests, at least in the public health system, are not meeting the criteria. This is unfortunately a result of there not being enough tests available. There's been a conversation about that for several weeks now nationally, and for some reason, I'm not sure why that information isn't really getting across, but that's just the unvarnished, not sugar-coated situation. Is there simply are not enough tests for everybody to be tested on demand, like we are used to seeing when we go to the doctor and we present with we may think is the flu, and we tell our private care provider that, and we can get a flu test and we get our results back very quickly. So if you want to call it rationing, I mean, that's probably the best way to talk about that. They're trying to utilize the tests that they have for the people that are most likely going to test positive and that are going to need that additional follow-on care. We've seen some advances in the last week, and in the next week to 10 days, we should see further expansion of testing. Abbott Laboratories has now come out with an FDA-approved device that's going to allow testing to occur much more frequently and on a broader spectrum. And that's a good thing to see. If you've been paying attention to the information the governor's been disseminating, the objective is to try to get to where we're administering over 100,000 tests a day. That seems to be the target or the gold standard, as he said, that was achieved in South Korea, who has had a very high success rate in controlling the spread of the virus, and has had a very high success rate in patients that have contracted it actually surviving. So we're working towards that. We have the issues here at home that have been implemented as far as closure of the beaches, closure of the bars, restrictions on restaurants as far as being able to only provide delivery or carry out or drive-through type service. Certainly promoting the social distancing amongst individuals. There has been conversation about shelter-in-place orders throughout the state on a community-by-community basis. So we certainly appreciate the governor's tactical approach to this. We refer to it as using a scalpel versus a chainsaw to solve problems. We very much support that philosophy that all communities are not the same. We fight every year with the legislature to maintain home rule. And, this is one of those times when that is the most important, because it's really important that emergencies are managed at the local level, and that we as a community get to make the decisions that are going to impact us, and we don't have them being made by somebody 90 miles away or 900 miles away. And so we certainly appreciate that. The Emergency Operations Center is activated just like it was during Hurricane Michael at Category 1. Again, their primary role is logistics, but there are a number of interactions every day between the state of Florida, the CDC. We have a weekly policy group meeting where we have all the mayors and city managers and senior members of all the municipal staffs on call to make sure they have the latest and greatest information, and then daily we disseminate to each of them a situation report so they know what's changed in the previous 24 hours. And so that's going to be the new normal for us here for a while. And we're trying to make sure we have a good understanding of the unintended consequences that are associated with this. You can imagine requiring people to stay at home, who are out of work, who don't have the ability to necessarily earn an income, the impact that's going to have, the impact on mental health, the impact it may have on domestic violence, the impact it may have on healthcare from other perspectives. Those are all things that are in our sphere, if you will, that we're looking at every day, and trying to make sure that we're ahead of trying to have addressed. Largest impact financially, of course, will be in the form of the taxes that are generated as a result of our tourism industry and it not being able to function fully. And we're monitoring that on a day-to-day basis and make the appropriate adjustments, budgetarily to contract our budget and to reduce or eliminate any spending that's not necessary, so we don't get ourselves into a hole that we can't dig out of, for the next year. But primarily, we're talking about sales tax, gas tax, the infrastructure surtax, general state sales tax revenue that's generated that supports the school system. Of course, you got the city of Panama City Beach that doesn't have a property tax that operates off of their 1% gross receipts tax. Our initial information there is that they're down about 30% already just for the month of March. They're projected to be down somewhere similar in the month of April, and we're seeing through the TDC cancellations on reservations now as far out as June. So this is going to take a toll on the community financially as well as from a mental health perspective and a health perspective, and we're trying to stay on top of that as far ahead of that as possibly can. And so with that, if there's any questions, I'd like to spend the balance of the time answering questions if there are any.
Bob, this is
all right. Go ahead. Questions?
Yeah. This is. Can you hear me? This is Larry Kubiak in Tallahassee.
Yes, sir.
And I have two questions in particular. I work at Tallahassee Memorial, and we're in the same kind of situation in that we've only had 5 people hospitalized with the coronavirus right now. And so we still have capacity, but I hear what you're saying about the surge. I have two questions. The first one is, and I'm not sure how familiar you are with Rotary and so on, but do you see any particular roles that Rotary can serve in our district to assist with what's going on, certainly in Panama City, but throughout the Panhandle? And my second question is, I'm a psychologist, and I have to say that after Hurricane Michael, I work in a psychiatric hospital, and we saw so many more admissions, especially with kids, related to mental health issues associated with Hurricane Michael. And you did touch on it a couple of times, mental health needs. So would you talk about what Rotary might be able to do, and in particular, any specific mental health needs that you think will be particularly problematic during this, the continued issue with Hurricane Michael and with COVID-19?
Sure. So to answer the first question, two things. One, in warm bodies. Anybody that has time that's available to volunteer, I would say at this point, volunteer for anything. Certainly, we'd want to make sure we're able to place people into situations that are vigilant of their health situation, their physical abilities. But a lot of we don't know. When you think about planning for pandemic exercises, most of this is tabletop. And so I think what you're seeing nationally is a lot of holes in that plan, if you will, because traditionally people sit around a table and talk about what they're going to do and how they're going to do this and how they're going to do that, but it's not implemented frequently like you see plans for hurricanes or for wildfires. And so while there's going to be, I'm sure, a significant number of shortcomings identified in this overall response process, it will also be utilized as a learning opportunity. So I would say that if there are people who are looking to make themselves available, whether it's, so we get, we have requests that flow to the EOC. So for example, if the school board came to us and said, hey, we need help with people helping to, pack these meals up that they're providing to the students, we'd like to have a cache of organizations who are willing to, put people in time together to be able to say, hey, okay, superintendent, there's 15 people available, maybe through the Rotary Club that would be willing to come and do that. So, that's the first thing. The second thing is just some idea of the different types of strengths and services that the agencies can provide. We have a rather robust non-government organization, kind of volunteer agency organization that's really come together and gelled after Hurricane Michael. We're still utilizing a lot of those agencies today in our community resource center. There's a lot of outreach provided to members of the community for needs that can't be addressed any other way, whether it be financial, healthcare, mental health. So if you have services or expertise that you're, you want to put out there and be able to provide, getting that information, getting it to, that group that sits in the EOC that oversees kind of that Herculean effort by all of our non-governmental organizations in the community, that can be done. The second question about healthcare, I think to me it's twofold. I think certainly you've got the impact of Michael, the anxiety, and the mental health issues that have been created as a result of that, and then you have this new incident on top of that. Certainly with a hurricane or a disaster of that nature, you can see the impact, you can see progress being made as recovery is happening. With this event, there's a lot of unknowns. I mean, you're starting to see the stories of how people are pulling up these mobile testing sites. They're bringing a family member with them. The family member is tested. They're at the point where they need, intensive care, and they begin treatment right there on the curb. And in a lot of instances, that's the last time these family members are seeing those individuals. They're going into treatment and they're isolated and they're passing away. And there's just going to be a significant mental health toll associated with that too. And again, a lot of, not knowing what we don't know. So, looking at some of the things that came out of Michael, the use of telehealth for the provision of mental health services, I think is an outstanding platform. It's worked, really well in the school system, but I think there's going to be broader application of that. And I think as resources can be stood up to provide that on a demand basis, if you will, so people can go somewhere and reach out and kind of get that via the telehealth platform from their home, certainly with the social distancing aspect of the way our lives are operating today would be very, very important.
Thank you very much, David. Bob, appreciate that. Yeah.
Other questions? If not, Bob, I have a question for you. In Bay County, have the citizens in Bay County been relatively compliant with the social distancing, or are they having problems with people still going to the beaches despite them being closed, and or businesses, restaurants, and the like being compliant with not allowing people to, to sit down and eat, or are things going well in that regard? Or are you starting to see some strain on efforts?
I would say they are. I think the most telling sign of that is you can look at the traffic pattern. So if I use an example, one intersection probably near and dear to everybody's heart on the beach is the intersection there at Back Beach Road and Nautilus. It's probably the #1 delay causer of traffic east and westbound on Back Beach Road. From the time that the beach order was issued, over the span of 7 days, we saw a 20,000 per day reduction in trips through that one intersection in Bay County. We've seen almost a 30% reduction in traffic or trips, if you will, through intersections on average throughout Bay County, and that's at different times of day. So certainly the most prevalent times are at peak, which is in the morning, which typically would be morning rush hour, and then evening and afternoon rush hour, and then around the lunchtime. But we're seeing this reduction across the full spectrum. So clearly people are not out on the roads as much. which leads us to believe that they are adhering to the trying to only make the trips on the road that are necessary. We're certainly out there. Law enforcement is out there, doing their patrols and looking at the different establishments. And I think for the most part, we're not seeing, any systemic problems with people ignoring, congregating in large groups or, restaurants serving people in their dining rooms. I think everybody is doing their best to transition to, meet the recommendations of the CDC and the different components of the executive orders, that the governor has issued. And that's really, I think, the foundation and key to why you're not seeing these mandated, statewide shelter-in-place orders in Florida, is because the approach has been to try to obtain compliance voluntarily. And then when that doesn't work, you see the solution come in the form of the executive order from the governor. That's what happened, with restaurants. Is the order was sent out initially to reduce occupancy to 50% and, maintain social distancing. And I think we had a very good response to that here for the most part in Bay County. But certainly in other parts of the state, it didn't take, it wasn't followed. And so that raised itself to the next level where, government felt compelled to stick its big hand into, what communities were doing and enforce that. And so I think, again, back to my comment earlier about the governor using a scalpel versus a chainsaw, I think that's very much a telling sign of that approach. It's, try to treat everybody like adults and be responsible and not have to legislate these types of things. So we're not pulling our first responders off of their primary duties and, making them the restaurant police or, the spa police or the gym police, and allowing them to do their jobs and having everybody just, be responsible members of the community and do this voluntarily. But if that doesn't occur, then you'll see, more and more components of executive orders being added. And, that kind of goes back to one of the other things we're monitoring is, as more and more social norms are removed and people are restricted, the higher the anxiety, the more tension out there. And so there's a certain amount of attention being paid to that. And so the more we can kind of take care of this ourselves responsibly and not have to have it legislated or mandated to us, then I think there'll be some more flexibility, if you will, as opposed to a stringent, curfew and things that you've seen in some of these other states. And quite honestly, the reality is that even when these things are put in place, the resources don't exist to enforce them 100%. So, really, there is a school of thought out there that a stay-in-place order is really it's a feel-good thing. But if I could use an analogy for a minute, it's like fencing. You put fencing up, and what does fencing do? Fencing keeps the honest people out. The people that are going to break the law and cut through the fence, it doesn't matter if the fence is there. So it's a similar situation here. People know what the right thing to do is, and they're going to do it. And the folks that aren't, and depending on the magnitude of that may have an impact on the rest of us and further constrain social norms in the community. So we want to try to stay away from that. It's hard to say, and I don't think we'll ever be able to quantify that any of these actions have added to or detracted from the amount of spread or the number of cases here in the county. Certainly, we're significantly lower than a lot of other parts of the state. I can say with certainty that if we were to change something that we're doing right now and then the numbers were to spike, I think the public would look at that and say, well, you changed, process X and the numbers went up and there's a correlation there and that's a direct result. And there's no way to prove or disprove that. But certainly we know our numbers are low here. As we're sitting here this morning, I do anticipate those numbers to go up just simply because testing is going to become more and more prevalent. And it's kind of like we experienced here with the oil spill. We all know we have tar balls on our beach all the time. But after the oil spill, everybody was on the beach looking for tar balls. And then all of a sudden there's thousands of tar balls a day. It's going to be the same situation here. We know the virus is out there and testing has been limited. And as testing becomes more prevalent, we're going to have more positives. And so, we're watching that. We're watching the number of, tests as they relate to the positives. Right now we're averaging about one positive for every 20 tests administered. Again, no correlation there. A lot of variability in how people can track this, but we're using that kind of as a yardstick to other parts of the state and other parts of the community, just to kind of gauge, what the rate of spread is here. Another concern that we have is, and then we saw this with the hurricane. We are a very independent-minded community. We had a significant number of people after Michael and still today, that refuse help. They are bound and determined they are going to do this on their own. And so we're concerned that we have people that are, they're perhaps experiencing signs and symptoms. They're doing what we're asking them to do. They're social distancing. They're staying at home. But one thing we are looking for is, do they stay at home to the point where they need critical care? And then all of a sudden we have this, massive surge on the emergency rooms because, folks have maybe chosen not to get tested. They've chosen to stay home and kind of gut it out, so to speak. And then it gets to the point where they've got to have care, and, we've got them showing up at the hospital. So we have that in the back of our mind that, we're watching. We really can't do anything to prevent that if that's the course that people are taking. But we're trying to spend some time thinking through that, and hopefully it won't occur. But if it does, we're trying to make sure we can support it best we can.
If you don't mind, I would like to go back and ask you a question about Hurricane Michael, post Hurricane Michael, as relates to growth within the county, and the number of businesses, homes being built, and then also efforts to clean up areas that kind of, where you still see trees at a 90-degree angle. What approach the county is taking to kind of, make things look a little bit better?
Sure. So on that particular issue, we put a moratorium in place for 12 months after the hurricane to try to give everybody time to work their issues out with their insurance companies and their contractors. And so 6 months in, around April timeframe, April 19, our code enforcement officers began going out into the community, establishing relationships with individual property owners, getting a sense of what their situation was, and kind of began to monitor, if you will, the status of those different properties. When we got into the fall, October timeframe, we began preparing cases and bringing individual cases in front of our code magistrate. And we've pretty much are taking one of two approaches. If the property owner has been working on their property, if they've demonstrated they've had issues with their insurance company or difficulty with contractors, we're still bringing those cases to the magistrate, but we're advocating on behalf of that property owner. And then there's the opportunity for public input, so the neighbors can come in and talk about the impact maybe the property is having on them. But at the end of that process, the magistrate enters an order, and we're typically there to advocate on behalf of the property owner to make sure that if there's going to be additional time given, that it's given, because the property owner has really been doing their dead level best to correct their situation. And we're not putting our thumb on their neck and making the problem worse. But we do have a number of property owners who will not engage with us, or perhaps they've walked from the property and maybe now it's bank owned, or it's in the foreclosure process. Those property owners are given the same opportunity to appear and make their case. But generally what we're seeing there is our magistrate is entering orders to have those properties raised and cleaned within 30 days. And then the county will go in and do that. The cost of that would then be put on the individual property tax bill as a special assessment. And then the county will get that money back either by the payment of that tax bill by the owner, or if the owner fails to pay the taxes and it becomes a tax lien, then whoever purchased the tax certificate at that time would be remitting those dollars back to the community. So we recover that way. We also were approved by FEMA for the private property debris removal program. We have over 400 properties that were approved by FEMA. We're working on, I think we have another close to 1,600 that are in that pipeline that we're working on with FEMA to get approval. But that's the program where, if a property owner has no access to revenue from insurance, so there's no other way for that property to be cleaned, and it's as a result of storm damage, we can go on there with a contractor, we can clean that property, and then the cost of that is covered through the public assistance program. and we don't have to lien the property. We can just get reimbursed by FEMA for that. And that's been a very slow process, a very deliberate process. FEMA has to come out and inspect each one of those properties individually. We've got to go back and have environmental assessments done for lead paint and for asbestos. We fought with FEMA for a little bit to try to limit that to structures that were older than, I believe it was like 1978 was when the HUD restrictions went into place on, homes and the use of lead paint and asbestos not being, utilized anymore. We weren't successful in that, so it doesn't matter whether the house was built, a year before the hurricane or 50 years before the hurricane. We're having to put them all through that environmental assessment. So we're doing that. There is a lot of new construction going on in the community. A lot of that construction was in the pipeline prior to the storm. Certainly out on Panama City Beach, a lot of those developments that you see happening out there were probably in the pipeline for 24 months before the storm. There are 4 workforce housing projects that have been awarded since the hurricane through the state's Department of Economic Opportunity. Contracts have been awarded for those, and they're in the process of getting constructed, and we can get that information to you on where those projects will be geographically in the community. But there's a significant focus on workforce housing, and the situation here with this virus and businesses being closed down is going to exacerbate that. We know there's going to be a number of people in the community that just got back on their feet as a result of the storm, and now they've had their legs taken out from under them again. And we're going to be, continuing to address this issue with housing. Another initiative that's been going on at the federal level is the passage of the Stimulus Act, and we're beginning to see information flow out on that and what it means, particularly for small businesses and for employees. We're trying to push that information out to the chambers of commerce. So if you're a small business owner and you're looking for the ins and outs of who's eligible and what you can be eligible for through those programs, I would encourage you to contact either of the chambers. We're trying to utilize them as the kind of central points of distribution for that information regarding businesses. One of the things that's different about the loan program with this event is the traditional SBA vehicle, if you will, is a loan. These loans, they will be originated as loans, but they're going to function more as grants. So if the business owner takes the loan, applies the principal of the loan to the eligible expenditures in the program, then the principal on that loan will be waived, and all the business owner will be responsible for is the interest. And I'm sure that'll mean different things to different business owners based on their individual financial conditions. But the objective there is to allow business owners to continue to meet their payroll obligations, to pay rent, to pay utilities, and to try to maintain some type of viability and bridge them over this so they can open the doors back up and stay in business when this is in our rear view. And I imagine that there will be several more federal funding bills going forward, and that program is going to have to be extended, especially if we're going to continue to see these 15 to 30-day extensions of these social distancing guidelines. So we're trying to make sure that the employees and the business owners in the community are getting that information, so that if they need to apply individually for benefits under these programs, or if the businesses need to apply, they can go out and do that, and those programs can be used to help bridge this economic quagmire that's been created as a result of this.
Okay, Bob, we thank you for answering my questions. We have a couple of questions coming through the chat room. The first question is, do you see the county, state eventually closing or requiring mandatory quarantine?
I would hope not. Is it a tool in the tool bag? Yes. I think if we can continue to see the curve flatten, I was very encouraged yesterday to see several of the data sets that were released by the president's Corona Task Force, and how a number of these communities, major metropolitan areas, who began experiencing positive cases much earlier than we did here in Bay County. You see in those data comparisons how their data is flat compared to areas like New Orleans and New York. And I think if we can maintain that trajectory here, I think the likelihood of shelter-in-place orders are very slim. But if we see a spike and it starts running away, the conversation then becomes something that we do at the local level, or is it something that we go and we ask the governor to assist with? And the governor's been willing to do that when communities ask. The first couple of shelter-in-place orders that were issued, he did by executive order, but he did that at the request of the leadership, the elected leadership in those South Florida counties. So again, if we can do this ourselves voluntarily and be smart about it, I think the likelihood of that happening is slim to none. But could it happen if it gets away from us? Absolutely.
Next question: what percentage of the county staff is working remotely, and how is the morale of your people?
I can't give you an exact number of employees that are working remotely. I will say this. One of the things that I've been careful not to do is pigeonhole my senior leadership team into hard and fast, one-size-fits-all decision-making related to staff. So the approach we've taken is we've tried to stay consistent with the CDC guidance. So, for example, any of our employees who are 65 or older, we've either tried to move them into positions where they could telework if they were in a position where they couldn't. But the objective there was to allow them to not have to come to work and stay at home as part of that the population that's in that highly vulnerable group. Same thing with any of our employees who have pre-existing issues with immunity. We've allowed them again to work from home. If they're not in positions where they could telecommute, we're attempting to move them into positions where they can. In our road and bridge area, for example, we have a number of individuals there who have immune deficiency issues. We're taking a little different approach there. Those employees can't typically telework. They're out there operating heavy equipment, or they're responsible for surveying right-of-ways or inspecting right-of-ways for projects that we're doing. A significant number of those individuals, we're able to send them home with their vehicle. They can receive their work orders via email from their supervisors. They can get in their county vehicle. They can go to the work site. They can do their job, and they can go home, and they're not generally in contact with members of the public or other members of the road and bridge crew. Typically, the time of day that they would be in contact, in a setting that would be in violation of the social separation guidelines would be in the morning when they have their crew meeting, and in the afternoon when they come back and they do their afternoon debriefing. So all that's being handled remotely. And so I say all that just to demonstrate that we're trying to be flexible and to make critically thought out decisions regarding our staff, so we can, one, have their safety paramount, their health paramount, their families' health paramount, and ultimately the community's health paramount, but also continue to function and provide the essential services that that the community needs us to provide. If we shift to our emergency responders, our 911 telecommunicators, our law enforcement officers, firefighters, EMTs, paramedics, the people that treat water, that treat wastewater, the folks that handle, sanitation services. We don't typically think of all of those in the first responder category, but they are. And, one of the things, if we were to have a situation where we weren't able to handle solid waste, for example, which, your household garbage, the impact of that to the community's health would pale in comparison to what this virus is doing. So there are essential services that have to be maintained. Clean water, sewer service, and sanitation are at the foundation of that. So in those scenarios, if we can operate some of those functions where we can go to 50% staffing, we're doing that. If splitting shifts works better, we're doing that. But again, it's all about my department heads on the senior leadership team being the subject matter experts in their functional areas and giving them the flexibility to, reassign their staff accordingly so they can get the job done and be at work, or if they need to be at home telework, they can. We will end up with a small percentage of employees who don't fit into any of those categories. And, they will be at home, and under the extension of the Family Medical Leave Act, we're going to be required to provide them leave benefits. And so that varies depending on their position. So, for example, if they're at home having to care for a child because schools have been closed, under the new rules, we've got to provide 12 weeks of paid leave. So, we're doing our part to address that. We're trying to make sure that the impact on our employees, on the community, isn't negative, or we can have some control over that, and that we don't pass anything on to our neighbors or to our family members. And we look at it from an analytical standpoint. It's certainly cheaper. If I look at this just through the business perspective, it's certainly cheaper for me to pay certain employees to be at home than to have them in the workplace and to contract this, and then for that health care to be filed on our health plan. That will drive premiums up. A significant amount of those premiums are paid by the county. That gets passed on to the taxpayer. So we're trying to come at this from a full 360-degree perspective to make sure we're taking care of the employees' health first, taking care of the community's health, their families, but also trying to have an eye towards what the financial impact of this could be and try to make those critically thought out decisions with that in mind as well.
Excellent. And there is a shout out, a BZ to you and the county staff for transitioning during this pandemic. Thank you. Job well done. Are there any other questions? If not, please join me in giving Bob a big round of applause and to thank him for all that they do for us. Thank you.
Thank you very much.
Great job.
Yeah. Bob, we normally have a cup, a coffee mug from the Rotary Club of Lynn Haven. We will make sure that one gets dropped off at your office. We just have one little request that for the rest of your life, you do not drink out of anything else but that Rotary Club of Lynn Haven Florida cup, okay? But in all seriousness, we really do appreciate you. And I think I speak on behalf of all of our Rotary clubs that, we really appreciate all that the county does. And, we appreciate your leadership. And at any point in time that you feel that you want to stop into any of our clubs, please feel free to do so. With that, is there anything?
Yeah, just if I could, in closing, I appreciate that. And just, I'm proud to, be a member of the community, but also very proud to be part of a 700-member team down here in the county that gets it done every day. And, they're the ones that make it happen. And, the thanks and the credit goes to them. My job is just try to make sure they've got the funding and the training to do their job and then stay out of their way and let them do it. So, again, appreciate the opportunity to talk to you all this morning. And if you have any further questions, please feel free to get with me offline or any member of our staff. We're more than happy to help you out.
Thank you, Bob.
Okay, thank you.
Urban.
Yes.
Before we go, Ms. Jan Pooley, our district governor-elect, is on our call. Jan,
Yes.
do you have anything that you'd like to talk to our group? We had 35 Rotarians from Area 4 join us today, and we look forward for more joining us next week. Jan?
Well, number one, congratulations for doing something like this. I think it's absolutely awesome to be able to bring all of your clubs together and to hear a message like we've just heard. Very helpful. I was taking a lot of notes as Bob was talking. I also want to let you know that there are a lot of things going on behind the scenes. I was on I think I'm becoming a professional Zoom call, but I was.
All right.
Yeah, we probably all are. But I was on a call last night that was presenting a program that is just now being implemented up in the DC area, where it's just a way for Rotarians to help in help with deliveries of needed goods, whether it's food, meds, to those people like me who are senior citizens and compromised immune systems. And, whether or not we will participate in that, I thought about that as Larry asked his question of Bob about what Rotarians can do. There's many ways that we can interface, and I think we're facing, all know unprecedented times. And so any ideas that you have for needs that you have in your community that you think you can meet, please work through your AGs and work through your district leadership teams. you know, this is a time for us to really create new ways of being Rotary. So I think it's awesome. I have another call tomorrow that I'm not sure, I haven't had a chance to read the documents yet, but the district governors-elect from zones 33 and 34 are working on a program of how we respond going forward. So I think it's going to be a more comprehensive program. So stay tuned, and any kinds of ideas like that that you have, please push them up. This is really a bottom-driven organization. And so we welcome any and all suggestions, recommendations, and offers of help. So thank you all for doing this.
Does anyone have any questions for Jan? Does anyone have anything for the good of the order? If not, our first Area 4 Rotary Club meeting is now adjourned. Thank all of you for participating, and do everything that you can possibly do to stay COVID-19 free. Thank you.
Thank you, Reverend.
All right. Thank you. Thanks for doing this,
Bye,
guys.
everybody.
Bye-bye.
Thank you.
Bye-bye.
Bye.